Hi, my name is Dr. Blessing, and today we're going to talk about blood tests you need for perimenopause. So we know that there are different there is no one blood test for perimenopause, especially if you're still in the transitional phase. Now, once you've gone a whole entire year without your period, your lab work should show decreased low levels of estrogen and of course progesterone and the other sex hormones. But while you're in the middle or at the beginning of perimenopause, your blood work is probably going to be normal. Now, there are some things you should definitely check. Since estrogen is cardioprotective and it also helps increase our HDL, the healthy cholesterol, and decrease LDL, one thing that you can spot out on a blood test is if you start seeing a shift in your cholesterol levels and an increase in your LDL cholesterol, in addition to other perimenopausal symptoms, that is something that you should take a look at. In addition to getting your cholesterol checked, it's also important to just go ahead and get your yearly exam and also do blood work regularly. So what blood work will do is it'll eliminate other conditions that may coexist with perimenopause and may make your perimenopausal symptoms worse. So getting a full thyroid panel. So the free T4, free T3, TSH, and I think there's a thyroxine. Get the full panel. Don't get the basic one because the basic one is not enough to give you enough information on whether you may have hypothyroidism. Also, since fatigue and exhaustion is another common symptom of perimenopause, it is important for you to get that anemia panel, right? You want to rule out that you don't have iron deficiency anemia or any other type of anemia that may be masking or mimicking perimenopause. So my recommendation for blood tests for perimenopause while you're still in that transition is to make sure you get your regular blood, your annual blood panel. Make sure that you're getting an anemia panel, you're getting the lipid panel, and you're getting the full thyroid panel. So once you do that, you can either rule out or rule in whether or not you have coexisting conditions that are there with perimenopause. If you're fatigue or your unwanted weight gain, you will know whether it's caused by hypothyroidism, perimenopause, or both. So that's what I recommend for blood tests. So you can go ahead and get your sex hormones tested too, but at the end of the day, if you're in the middle of perimenopause, for most women, those values are going to be normal or within optimal range. So it is important to look at the other factors that I've talked about in this video, and then find a healthcare provider who actually listens to you. You don't have to stay with healthcare providers that gaslight you, tell you you're not in perimenopause, tell you that it's just a figment of your imagination. Fire them and find a healthcare provider that you can work with to help you navigate this kind of confusing and overwhelming time of perimenopause. If you've learned something for this video, don't forget to like, share, and subscribe.